Right, let's go into another issue. I said to you tonight, I'm going to bring you people at the coalface. Well, listen to this. We know a lot of the second wave is happening in and around Melbourne, but one regional town in Victoria's southwest is bracing for even higher surges in COVID infections than they've seen in the past few weeks, and that's a real worry. This is the Colac Otway region. It's just on the outskirts of Geelong, heading down into the Western Districts. 4 confirmed new cases today, 55 overall. Now, that's a real worry in a town and a community with an older, more vulnerable population. And despite that, locals say they've been left behind by health authorities. Anthony McDonald is a local businessman in Colac, the rural real estate manager with Charles Stewart Real Estate, and he joins me now from Colac. Thank you for your time. I really appreciate this. I think it's so important to talk to people out there faced with these issues rather than what we're just being told by officials and government. What has been the circumstances that you've faced on the ground in Colac once this outbreak really got underway?
Hi, Peter. Unfortunately, here in Colac, we've had this outbreak occur, which started Friday a week ago now. Unfortunately, we feel in Colac that we've been left a little wanting for assistance from, particularly from DHSS. One of the biggest issues, Peter, has been the lack of, or the time taken to actually for them to process and get back to people with test results. We've seen a number. I actually had contact with a business person here in Colac this afternoon that finally received their result today after being tested last Monday. So that's 10 days to get a result back. This guy's a business owner in Colac trying to run a business. He, of course, did the right thing and self-isolated for that period, but he's waited for 10 days to get a result. Quite a few other people, in my own personal experience, 2 family members were tested last week and received their results after 4 and 6 days respectively. And of course, we've had Dan Andrews saying, the average is 2 days. So we just feel here in Colac that we're being, treated as perhaps second rate, or we're not getting the same prioritisation that the metropolitan areas are receiving.
What's morale in the town? Because your case before, the businessman who waits 10 days to get results, presumably, if he's concerned he might have it, his staff who would have been working with him for that period of time would also similarly be in the same situation. So what happens to his business in that period of time that he's self-isolating and waiting for results? What's the town going through?
Yeah, look, the morale in the town is surprisingly good, and that's, I think, a product of the fact that we've got a local health service, Colac Area Health, who are doing an outstanding job. They really are going above and beyond, and kudos to them. Bowen Health assisting them, and they're also seem to be working very hard. And so, with those sorts of services here, they're providing some level of comfort and reassurance to the community. But at the same time, we feel that we're not getting perhaps the support we expect from DHSS.
Can I just jump in there, Anthony, just before you move off DHSS? A lot of complaints have been about the inconsistency of information from the health department. That's what DHSS is for people outside of Victoria. What's been the sort of level of information and the consistency of information like in your experience?
Well, one of the issues has been the lack of information that's coming directly from DHSS to the business owners. Obviously, this outbreak started with ALC, who are the largest employer in town. AKD, one of the other large employers in town, have now had a positive case. In both those cases, I've spoken directly with both of the managers of those businesses, and they've had scant information directly from DHSS, and have had very little support at all from the organisation, the government.
Just so people at home can follow, Anthony, both of those businesses, or certainly one of them, ALC, that's Australian Lamb Company, that's an abattoir. Yeah. And we know that abattoirs are in the epicentre of these outbreaks.
Yeah, exactly. That's right, and that's the concern. So most of the outbreak has now, been attributed, or is attributed, of course, directly to ALC. But just today, we've learned that there seems to be a little bit of community transmission happening. And that's a real concern because it seems that it's now escaped just the cluster of ALC and is spreading into the wider community.
Just before we go, do people in Colac, do they want to be locked down like Melbourne? Do they think it's got to that, or are they happy with the arrangements as they are now that it looks like you're getting a bit more of that testing regime happening?
Look, I think there's mixed feelings on that. I know the Mayor, Jason Tram, certainly has been calling for lockdown, and it is certainly a big concern as far as aged care facilities are concerned, as far as schools are concerned. From a business point of view, we're perhaps not quite so sure lockdown is what we need. The community are doing a really great job. I've been out and around in the community, this week, and the street is empty. A lot of businesses, probably 2/3 of businesses, are either closed or are closed to the public or working on skeleton staff. So, there's mixed feelings, I guess you'd say, about lockdown.
Anthony McDonald, thank you very much for your time. Appreciate it.
Thank you, Peter.